Hi, it's Dr. Elisha Van Dusen with New Hope Chiropractic. Today I'm going to tell you how to step away from bunion pain with chiropractic care. Foot pain can be really debilitating and cause changes in your daily routine just because it causes discomfort while walking, which is a daily part of everybody's life. We gotta walk. One common source of foot pain is a bunion, which is a bony bump formed in the inside of the foot at the big toe joint. Bunions typically develop slowly and worsen over time, but chiropractic treatments can correct your foot dysfunction and return you to your regular activities. So what causes bunions? Bunions happen when the foot is not functioning correctly, and they develop slowly when the big toe drifts toward the smaller toes. So it's deviating sideways. This leaning causes misalignment and pressure on the big toes metatarsophalangeal MTP joint. I know it's a big word. This gradually alters the normal positioning of the foot's bones, tendons, and ligaments, and the result is a bony abnormality at the joint called a bunion. Because this MTP joint flexes with every step, as the bunion gets bigger and bigger, the more painful and difficult walking can become because of the direction of irritation on the bump and altered movement and mechanics of your foot. So bunions show up as a visible hump on the inside of the foot, and that causes pain and tenderness, redness and inflammation, hardened skin too on the bottom of the foot or on the bump, and stiffness or restricted motion in the big toe. Although more common in women and often hereditary through foot shape and structure, bunions can happen to really anybody wearing poorly fitting shoes, especially those with narrow pointed toe boxes that unnaturally cramp the toes. They can also be caused by inflammatory conditions like rheumatoid arthritis or neuromuscular conditions like polio. And advanced bunions can greatly alter the appearance of your feet too, with severe angling or callus development, both of which cause discomfort and impede walking, as well as introduce additional problems. In some cases, the enlarged joint leads to bursitis, which is a painful inflammation of the fluid-filled sac cushioning the bone near the joint. It also can lead to chronic pain and arthritis if the cartilage covering the joint becomes damaged. Other less common bunions are adolescent bunions, most commonly in girls aged 10 to 15, and bunionettes, which occur near the base of the little toe. In many cases, bunion pain can lessen by wearing properly sized footwear, reduces pressure on the big toe. Choose shoes with wide open insteps, broad toe boxes, soft soles, and stability, and avoid shoes that are too short, too tight, sharply pointed, or have heels above a few inches. For pain that occurs with movement, choose a shoe with a slight rocker bottom. Shoe fit varies even within a shoe size, so judge footwear not by a number but by how it feels on your foot. Find shoes that best match the shape and size of your feet. They should allow adequate space for your longest toe and a good fit for the ball of your foot in the widest part of the shoe, and a comfortable fit for the heel with minimum slippage while walking. Feet can change over time too, so have them measured regularly at the end of each day. Also, most people have one foot that is larger than the other, so make sure to fit the largest foot. Also, protective silicone pads can be worn inside the shoe to help cushion the painful area over the bunion. This can increase pressure though on the bump and worsen the pain, so you got to be careful here. You can also try over-the-counter custom-made orthotics. That can also help too. Something that we offer in our office actually. Takes about a week and a half to get them, and we make a specific customized mold of your foot. So cases where extreme pain persists despite changes in footwear and other non-surgical treatment, surgery can even be used to correct a bunion deformity with the goal of relieving pain. It realigns the bone, ligaments, and tendons and nerves so the big toe can be brought back to its correct position. Typically involves shaving off the tissue sticking out and perhaps part of the bone to straighten out the toe. Cautionary point though is that surgery commonly carries along recovery from 3 months to a whole year and includes a period of immobilization with no weight bearing, time with crutches or a walker, and time in a splint or a boot. So this is should not be your first option, your first recourse. So that's where chiropractic care comes in for bunions. It's non-surgical and it helps treat foot pain caused by conditions like bunions. Many people have feet that are all locked up, which causes pain and deformities. And with specific chiropractic foot adjustments, we get the 26 bones in the foot moving the way they're supposed to. Most people, including many podiatrists, don't even know that their foot is locked up because they don't check the different joints in the foot. So foot adjustments, again, are really the most important part of the chiropractic treatment here. And we don't want to simply cushion your foot or avoid the problem by making more space in the shoes. We want to restore the correct function in your foot and align all its joints. So if you're dealing with bunions, or you know somebody who is, and you've been dealing with it for a long time with no results or good outcomes, we'd love to help you out. Just check us out at newhopechiropractic.com. You can make an appointment through our website, and we'll be glad to help you and see if chiropractic is right for you. Have a healthy day.